Hello, everyone. This is Dr. Mike Chua, physical therapist, certified dementia practitioner, and your alternative career coach. Welcome to our career healthcare podcast and show where we talk about different ways to find your alternative career and achieve both work and financial freedom. So visit our website, drmikechua.com or alternativehealthcarecareers.com for more information. Again, thank you for watching and listening. Welcome to our show. Be awesome, be great, be excellent, ACG. Have a great day and enjoy the show. Bye-bye. What is going on, Alternative Careers Group? This is Dr. Mike Chua again, physical therapist and certified dementia practitioner. And yes, we are going live tonight with Shayna Young of Optonome. I hope I'm pronouncing that right, both her name and her company's name. So if you are watching live, ladies and gentlemen, Alternative Careers Group, ACG, comment live. And then if you are watching on the replay, obviously, comment replay. So again, today is a special day or special night. It's an interview with Shayna. And obviously at the end, we're going to be, what do you call this? We're going to be raffling, if there's such a thing as raffling. Is there a word, raffling? Raffling? We're going to raffle out all our different courses tonight. So if you are ready to learn and win those prizes, and for those people who commented on my previous live last night around 9 o'clock, put in excited there, So, well, before I keep on going, because I don't know how to stop talking, and English is not even my first language. Imagine that. Shayna, tell us who you are, where you're from, what do you really do, and why are we here? Tell us about you, Shayna.
Sounds good. Can you hear me? Because I don't see a video of myself.
I hear you.
Uh-oh.
Yeah, I hear
you.
There
we go. All right. I see myself. Hi, everyone. I'm Shayna. I am an occupational therapist. Mike, give me a thumbs up if you can hear me. And perfect. Oh, now I can see. Okay. We're there. So yeah, I'm an occupational therapist of 9 years. I live right outside of Philadelphia. And yes, I am.
9 years? You don't think, gosh.
Yeah, 9 years.
I mean, I hope this is.
I was thinking about that today.
It's not even. You don't even look like. You look so young.
It's the lighting. I have some lighting in the background. That's
I need to get that lighting for me. All right.
Said that you look like you have a great glow going on right now.
Thank you. I put on my makeup, so.
There you go.
All right. So before you keep going, I would just like to welcome again all the people who are watching. Real Boyd, I see him, Becky, and the rest of the people who are watching. Thank you very much for commenting there. Really, really appreciate you. So, Shayna, so tell us about you again. I know you're an OT, and what do you do for Optonome? I hope I'm pronouncing that right. I've been saying Optonome. Sounds like a robot. Or what is Optonome or Optonome? How do you even pronounce that? I mean, and what is it about? And I hear about all this, what is this? Is this too good to be true? Bam, 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 blah, blah, blah. So tell us about it, and then we'll figure it out if it's really a good fit for us or for somebody out there.
Love it. All right. So Optonome stands for two things: autonomy and optimal. So it's just combining those two words together, Optonome. So the goal is really for you as the healthcare professional and your consumers, which are your clients or your patients. In our world, we call them consumers, to have that independence and live with maximum autonomy. So I know a lot of you guys out there are struggling. I personally was struggling myself. More so with the documentation and feeling like I was talking to a computer all day, even though I was literally like face to face with my patients every day. And I just felt like I wasn't there for them. And like my final straw was like a patient was in front of me crying. And instead I was like, so what is your pain level? And I was like, what am I doing? Like I'm an OT and I'm not even like really there for my consumers, my clients. So I stumbled upon Optonome, and Optonome essentially puts you as a boss. If you're an occupational therapist, PT, OT, speech therapist, or behavioral specialist, and it gets you to have your own home healthcare agency that is not med bay. I know most of you guys are like, oh my gosh, like I don't want to get into that realm right now. It's not med bay at all. It's getting you to provide services, non-medical and medical services. A lot of us are used to medical services, direct OT, direct PT, direct speech therapy. This is, you get to that level, but you actually start with non-medical services first. So again, when you have your own home healthcare agency, you are able to help people do one of two things. You can help older adults age in place, and you can help adults with disabilities to be able to live on their own with support. So I'm helping with adults with disabilities live on their own with support. So yeah, Optonome, essentially I found them, early last summer, and my agency is just about ready to get started. It takes about 6 to 9 months for your agency to get started.
Why
but
6 to 9 months?
Yeah.
Is it that long?
Yeah. So even if you are doing your own home healthcare agency on your own, it takes at least 6 months for you to get started. So Optonome guides you through the whole process. Optonome guides you in picking out your name, your mission statement, your vision statement, LLC processing, and then getting you qualified in these different services to be able to do really cool things for your consumers. So it's not like what I said, Med A, like you go home, you break your leg, and you get home therapy. Like this is, if you're focusing on adults with disabilities, you're focusing on helping them live on their own with support. So each one of them has an ISP, and in that ISP, it'll say, Jim's trying to get a job. Jim's trying to interact more appropriately in the community.
What is ISP?
Oh, good point. So,
let me guess. Intergalactic super power. Just kidding.
That's very close. Well, it's an individual support plan, and many of us know that. If you're in the school setting, you'll hear like the ISP a lot, or no, the IEP, sorry. But once they hit like adulthood, it's the ISP, the individual support plan. So you're focusing on their goals in the ISP, which, like I said, will state, Jim's trying to take public transportation appropriately. He's trying to learn how to cook a meal. He's learning to, go to public outings appropriately. These are people like that have autism, intellectual disability, mental health issue, and you're focusing on those goals. So you could actually be on a bus with them and learning and helping them learn how to take public transportation. You're actually focusing on goals, yes, inside of the home, but you get to also go outside of the home as well and help them to find a job, get a job, maintain a job, and those take years. So the other cool thing about this, if you have your own agency, is you're with them for years and you really get to focus on what is meaningful to them. So that's what gets me excited as an OT, because all of us OTs are like, what? Like you get to learn how, you get to like actually do like real occupation-based stuff. And yeah, that's what a lot of payers, especially Medicaid, reimburses you. And yeah, really cool stuff.
Okay, so there you go. You're a business owner. I'm a business owner. So I want to know where my patient comes from. I want to know, you mentioned already part A. So correct me if I'm wrong. I'm trying to figure out. Okay. So, sorry. My hands are so crazy, right? So part A is the regular home health agency, right? What do you call that? The home health agency for part A, hospitalization, right? And then part B, that's what I'm doing right now, wherein I'm an outpatient clinic that I go to home, or you have an outpatient clinic that patient goes to you, right? So does Optonome where's the payer source? You mentioned Medicaid. Is that where we come in? Is that where you come in? You bill Medicaid? Is that how it works?
Yeah, so we have multiple payer sources. If you start with adults with disabilities, your major payer source will be Medicaid, as well as some private pay. If you're with older adults, and we're looking at how autonomy is scaled. We want to make it as successful for you as possible, as cheap for you as possible, and as easy for you as possible. So everything is guided like along the way. And in order for you to be successful, we want you to start out with non-medical services first. So this took me by surprise at first. Like, wait, as an OT, I can actually provide non-medical services, or I can be the CEO and help give non-medical services where I have assistants working with me that help to provide these services. And yes, you can do that. You can do that with your own home healthcare agency. So you're able to provide these non-medical services for adults with disabilities. And then as your agency grows, you can be able to add medical services, which is what you think of, that direct OT, PT, that Med B. But you can also grow in your agency and providing 24-hour care. That's a medical service. Having a nurse on staff, that's a medical service. Giving medication. And autonomy essentially gets you from like starting with non-medical services all the way up to where you can be what's called deemed status. And deemed status is you're Medicare certified. You're able to get your direct, that's what I'm looking for, referrals from hospitals and managed care organizations. And the good thing about autonomy is that they give you your clients. So you don't have to market yourself, which is a really nice thing. So yeah, you can start out with Medicaid if you're going with adults with older adults with disabilities. And then you can start to scale. You can add on private pay. You can add Medicare. As your agency starts to grow, you start to get qualified in different types of services. So you're not just qualified again as an OT or a PT, you get qualified again in providing non-medical services as well as medical services. Does that make sense?
Wow. Yeah, it's clear as a mud, but it's clear to me now because I've been listening to you and learning from you. But I'm sure there are a lot of people who are actually asking, what is it all about? As you learn about the company, if you're watching right now, you will learn about it. I'm seeing a lot of people commenting hello during the hello Elizabeth, hello Bill, and everybody. And Ruth here has a question. How do you start with the geriatric population? So let me answer that real quick, Ruth. I guess first is you need to learn how to protect yourself. Start your own company first. You start with a business license, and then you go from there, and you target which specific niche or audience you want to serve. Geriatric population is so big; it's a very big niche to serve. So you can either do specific like dementia, like in my case, do Part B, or if you really want to provide the services like what Shayna and the Optonome people are doing is aging in place. You can reach out to Shayna. Junaland is asking, how can I contact you, Shayna? Maybe through Facebook Messenger. You can reach out to Shayna, add her as a friend. Is that okay, Shayna? They can add you as a friend?
Yeah. I'll give you some links too. Like I'll show you my group, which shows other agencies getting started around the US. Currently right now there are 11 states getting started.
11 states. Oh, wow.
Yeah.
Okay.
11 states in like the last couple of months. It's been like tremendously growing. So it's been really cool to see that and to connect with everyone.
Oh, that's good. That's good. Okay. I guess before we keep going, let's do a special raffle. If you guys are ready for the raffle, we'll do one raffle for now. We're going to raffle. The first thing is the UR course by Bill Daly. Bill, if you're watching, we're going to raffle your course, man. We're going to raffle your course. We're going to bring out we're going to do first, one. So if Shayna, we figure it out how to do this raffle. So just give me a crazy number right now, Shayna, like a random number from 1 to 20.
Let's go with 11, number of states getting started.
Number 11? Oh, gosh. So let me go back to the the 11th person who commented you are on that previous post that we did, right, Shayna? I'm going to go back there. So where did that go? Okay, just bear with me, guys. So number 11, whoever commented, the 11th person who commented you are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. If I hope I counted right. Caitlin Daba Pritchard won. Let me write that down before I forget. Woo-hoo! Caitlin, you won. You are.
What did she win?
The UR course.
Ooh.
All right. Let me write this down.
Caitlin. There's so many comments in that one.
Daba Pritchard. If you are watching right now, Caitlin, comment down there. Congratulations, you won the UR course by Bill Daly. All right, so we got one more for that for that course. So you want to give a random number, Caitlin? Or Caitlin, Shayna?
Let's go with number 2, since there's 2 of us right now.
Number 2 for the UR, right? Let me go back up. All right. Katie Myers. Haman. I hope I'm pronouncing that right. Katie Myers, you won the second UR course from Bill Daly. So we will just reach out to you. We will provide you the sign up link and everything. So you got those 2 free UR course. I hope you find value in it. I hope you just don't watch it. And my challenge for you guys, both Caitlin and Katie, watch the course with Bill, learn from it, and take action on it, because it's not going to do you good. It's not going to do me good if you don't take action. The key here, go ahead and watch it. We got those free resources right now, and that's worth $97. Bill Daly, spent some time finishing that course there, and it's a free. And right now, make the most out of it, learn from it, devour it, and then we've seen people who have attended that course. To tell the truth, some didn't take action. Some didn't take action. They didn't become a UR, and some they are very successful working already as a utilization reviewer. So it's all about taking action, guys. All right. So if you are still watching, on the here, hold on. If you are still watching, where am I now? Gosh, where am I now? We got so much stuff going on. So Bill is commenting there. Congratulations. Woo! Cool. All right. Okay. So go ahead and Shayna, keep talking about autonomy. We're going to be talking talk about autonomy again.
All right. So let's talk about like what people wanted to know, like what I wrote on the post, like how are you getting time freedom? How are you making 6 figures? And how are you like actually making a difference with these consumers? So Optonome is like your whole back office. Not only does it help you start your agency and get you federal and state regulated and educate you along that whole process, so you are a confident CEO when you start, you actually through that process, you have just Optonome that once you're up and running, is your back office. So that's your one person that you pay out, and the other person that you pay out are your DSPs, your direct support professionals. So those are the only 2 people that you pay out. As a result, there is no middleman. There is no other person that you have to pay out. So that's how you quickly are able to earn 6 figures while only working like 10 hours a week. So for Medicaid, like if you want to break that down, do you want me to get like really specific? Like, do you want me to talk about like the numbers of like how you get the numbers, Mike? Or do you want me to keep it real simple? You tell me.
Keep it real simple, KISS. Keep it simple, silly.
Keep it simple.
Okay. Because I'm having some information overload right now. But before you keep going,
like a really busy day. Oh my gosh, It's Friday. You had like a really busy day.
Oh yeah, speaking of busy day, you know what I did to, I just want to be, real with you guys. So I took the kids to school. I was supposed to go work out after dropping them off to school, but I gassed up my wife's car because uh they have to go to a band thing tomorrow. Two of my kids play the band, so they're going to leave tomorrow. So I had to gas up my wife's car or truck, and then obviously I didn't work out. So after gassing it up, I went home, eat breakfast with my beautiful wife, and then left to go see two patients. I saw two Part B patient, whoa, at home, and I spent good quality time with them. A full one-on-one. I haven't even finished the paper, but it's very easy. It's Part B, not Oasis. And then from there, I went to Jackson, Tennessee. It's an 1 hour drive to go to an orientation in one of the nursing home I am planning to work at. So whoever's watching right now from Maplewood, hello from Maplewood Nursing Home. And then after that, I was there probably like 2 hours, finishing up some Relias. Who here does the Relias? Gosh. So who does Relias? And then after that, I went to the assisted living I teach. So I went there. I did some group exercise, some group exercise with the people there, and they enjoyed. And I was supposed to be there just for 30 minutes. I was there for 2 hours because they were asking me stuff about therapy. So I got two patients there. Imagine that. I went to assisted living. I did some group exercise, like group hab, group exercise. Even though I'm overweight, they believe me because, I tell them, do it. So they were exercising. And so I got two patients out of there. And then I got home. I went home here in Martin, and I saw patients in the behavioral unit because that's my specialty, right? Dementia. And now I'm here with you. So it is very busy. Well, anyway, before... Okay, there is a question here. Sorry if I keep on talking. Ruth Fisher is asking, I'm interested in starting with Optonome. So she's, I just have more experience with geriatric population and trying to figure out what that would look like to start. Would we just supervise DSP who assist them in their homes, and how we grow from there? So that's a great question, Ruth. That's a great question.
Yeah, because again, like you have that specialty, Mike, because someone also had a question below which said, Mike, what are you doing with Optonome? What's your plan with that? So okay. So you're going to these clients within your home. So if you already are Med B certified, this is actually cool because you already are starting out medical. You can actually convert your patients, your clients to with Optonome and go non-medical. So you can help them after you're done with your service with Med B. You can take them on and you can be able to have them for non-medical services. So the DSP can help them with continuation of their exercise program, or if they need help with grocery shopping or light activities around the home, you can then continue that service with them, which is just great. And then with Optonome, you're going to see them one time a month for 1 hour for older adults to make sure that they're safe within their home. Anything else that you see as a clinician that you could provide additional services in, if you're a nurse, how does the nutrition look? I know that some OTs are in that as well. PT is definitely safety. OT is the same way too. SLP is the cognitive portion. So you're going to provide that clinical ongoing supervision one time a month for 1 hour for those types of clients. And with adults with disabilities, go ahead.
Do they have to have Medicaid, or who do we build in? For example, in my case, they are Part B and they have Humana, and obviously they're not Medicaid. So how does that work?
Yeah, so you can convert them, and you can do some private pay. You can do Medicare Advantage, and
so you're going to help us credential us too for Medicare Advantage and stuff like that.
Mm-hmm. Yeah.
Okay.
Yeah.
All right.
So there's
that explains it.
And a lot of new services open up for non-medical needs for Medicare Advantage, because I know some therapists were telling me Medicare Advantage sucks right now. But terms of for the medical side, but for non-medical services, they added in a lot more services to get approved to be able to provide. So
that's just a dollar sign to those business people out there, right? So yeah. Okay. Sharon Michelatus is asking, I hope I'm not murdering your last name, Sharon. Talk about homes for seniors, please. Do you also do that, Shayna?
So I'm not doing that right now. So I'm focusing on adults with disabilities. I did ask the CEO, Dennis Sticker, about that, and there are talks in the plans for building communities like that, where there are like a home setting for older adults that the health clinician, the health professional can manage. I don't know the full detail of that. I know that that was talks and that's a plan down the line, but I'm focusing on adults with disabilities, so I don't have the full answer from that. Yes, it's in something that we're planning on, but there's nothing definitive yet.
I have a question. You know, it's really very, very important. Why does Dennis Facebook is only Dennis?
Why is Dennis? Oh, is this your question? I was like, wait, I don't see this. I don't know. You know what? Like he's a software engineer. Like he's super duper smart. He probably like broke the codes and had his own like just first name.
You know, maybe I can use Mark Zuckerberg, right? You know,
he's
Mike Zuckerberg, right? I can do that. Mike Zuckerberg. All right. Okay. There's another question here, Shayna, from Angie. I see DSP openings in my local area, but they're about 11 to 14 per hour, which is different than through Optonome, correct? Do you know why such a difference?
Oh, I like this question. Okay, so with Optonome, the focus is to create livable wages for DSPs. $11 to $14 really isn't a livable wage for them. So because again, when you have your own agency through Optonome, you are able to provide livable wages for your DSPs. And the reason for that is because Optonome creates a job marketplace within the Optonome system. So think of like a pool, like an Uber pool, and it says like all these different skill sets. So these DSPs get trained not just to supervise or like manage your consumer, like they're learning and they're getting trained in supportive employment, which helps them to be able to, the adult with disabilities, to get a job. They are learning how to become a certified investigator. They are learning how to
become a certified dementia practitioner.
They could, like, there are some specialty areas. Some states, I know, like Florida has like, you know, some specialty in dementia, but yeah, I mean, you can get them trained so they can provide better quality of care. So we get them started, and we tell them, listen, like these are all the different types of services. Like this is all the different ways that you can grow financially as well as like education wise. Like you can start out with like livable wages and then earn up to $50 an hour. So even like CODAs or PTAs, like you guys can be a DSP and earn up to $50 an hour. For example, being a certified investigator is a $50 an hour service. So you're not just focusing on like direct care as a DSP. Like the DSP is getting this job marketplace to be able to provide and choose as long as they're trained to do these other different types of services, which keeps them retained within these agencies, keeps them happy, keeps them feeling valued, because they don't feel valued either. That's why they up and run. Like there's studies that show that they'll leave your agency 80% within the first year. So Optonome found that solution with this job marketplace. All the training is done through Optonome. You don't even have like all their background checks, their TB tests, their trainings. That's all done. By the time they get up to see you, you just do the interview. So you don't have to do all that crazy back end work. Like you just say, you interview the person and find if that's a good fit, because these DSPs, especially in Pennsylvania, they can bounce between different agencies depending on what the type of schedule that they want. So does that make sense? I know that may be a new concept, but we're really trying to empower these DSPs so they stay within your agency. They're happy. They feel valued just as much as we feel valued for our time in our own home healthcare agency.
That's so true. That's so true. We always want to provide a tap in the back for all our staff and our employees. So hard to work for a company that It's all about the money, and you want to provide a good value, good working environment, and ability to grow, and that's where all the burnout is coming from in our group. And I believe that a lot of people are not happy because of the current situation, and this is actually a perfect way for us to be able to grow as an entrepreneur, grow as a therapist, and be able to provide value to your community and at the same time be a blessing to other people. And that's the reason why I always ask God, you bless me so I could bless other people too. Help me to build a business, and that way I can employ people and they can, provide a good living for their family. And that's our ultimate goal, to provide a good living for our employees, and of course, helping out people. So thank you very much there. Um, there's another question here. Well, that's a question from my wife. What time I'm going to be done? But there's another question here from Jennifer. Jennifer T Hunin. How do you get DSPs? So, can you answer that, Shayna?
Sure. I just also want to bounce off of that I did the same thing too. I prayed for a really long time to help me find a job that's going to find meaning in my life. And I really felt like when I stumbled upon Optonome, like that was my thing too. And that's one of the reasons why you'll see my face a lot, me promoting it a lot, is because I want to give that blessing, hopefully, to you guys as well, to have that time freedom, but to feel like a healthcare profession again, like feel like a true OT, PT, and SLP. Like you get that when you have this type of home healthcare agency. So totally feel you on that. I just wanted to let you know. But yeah. So your question.
Before we go, let's go ahead and do a raffle. Okay. All right. Let's do the second raffle. I think we have what are we gonna do the raffle? The VIP kit. Oh no, the home modification. All right, so give me a crazy number, Shayna. Don't make me work hard. So, all right, give me
144.
Crazy... What?
No, I'm just kidding. I said 144.
Gosh.
7.
Again, 7.
Okay, no, I didn't say 7. I said 2. I did 2 and 11.
Oh, okay. Okay, 7. All right, so let's go back. Let me go. Do you mind counting? Are you there?
Oh boy. I'm not there. I thought you were there.
I'm going to go back, and I'm technologically challenged. Come on now, guys. So number 7, right? Where is that? Number 7 on the... Well, while I'm looking for it, could you answer the question by
you tell us Friday night, people. Yeah. So how do you get a DSP? I believe it was, because I just got off the screen. So just like most people, we all go through it Indeed.com, and Optonome will create that. They'll create a post on Indeed.com, and they will you'll get many DSPs right away, because we're going to automatically offer incentives of livable wages with the potential to earn up to $50 an hour. So we do that post. I don't do that post, actually. It's Optonome. And then they go through the process. They start getting onboarding training. They get their background checks. They get their TB tests. All of that is then infiltrated into the Optonome platform. And then you're then able to look to see if that's a right DSP for you. And then you have an interview with them and you see if that's a good fit. They're independent contractors, so they can have that job marketplace, to have that flexibility, to have that ability to earn up to $50 an hour, and to be able to have as many jobs as possible. Like, for example, in Philly, there's 20 agencies getting started, which is great. Like, because you cap out, if you are with adults with disabilities, you cap out around 30 consumers. That's 30 hours a week that you're working. But that's how you can earn like up to, depending on if you're having non-medical and medical services, anywhere between 300 to $500,000 from those revenues. So, yeah.
I almost fell there, right?
What'd you say?
I said I almost fell in my chair. 300 to $500,000. Oh gosh. Oh
yeah.
Oh Lord, make this happen.
That's why I say get your sign up for your home healthcare agency in a box. It's free. You'll get to see your financial forecast. You'll see your services that you'll get approved. But like I said, you are not just focusing on one service. You're not focusing on just the OT service, the PT service. You are getting qualified in multiple services. You're getting qualified in at least 5 to 10 different services that you're going to offer for your consumers. And as a result of that, you're able to get reimbursed for that, as well as that, you're managing these DSPs. You're providing clinical oversight and supervision to them. So, 10 hours a week. And like I said, I can talk about those numbers. You can also jump into my group. I have a lot of videos that show how 10 hours a week of direct service gives you a 6-figure net salary, with your ability to become a home healthcare agency.
Yeah,
so I can talk about it whenever.
So I think bottom line is that you're earning out of that passive, income from your DSPs. All right. So I already count number 7. I hope I did a good count there. It's Karen Mbly. Karen MBLY. Congratulations, Karen. You won the home modification course. Woo! By Jennifer Trevino. So all right, congratulations again, Karen. I know Karen. I know Karen. All right, give me a crazy number again, Shayna. So give me a number between 1 to 20, and then I'm going to count from the bottom all the way up.
All right, let's do
instead
15.
of from the top to the bottom, so it could be fair. So we're going to count from. So give me a number 1 to 20, and then I'm going to count from the bottom of the last post going up. So
let's do 15.
When is your birthday? A what?
15.
What? 15. Okay, 15 from the bottom all the way up of the of home modification. So hope I'm counting this right, but 1.
I don't think anyone's gonna yell at you. What if someone did? That would be really mean.
I know, right? 1, 2, 3, 4. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Laura Klein. Laura Klein, come on down. Woo-hoo. I'm writing you down here. I'm doing a fancy thing, right?
Yay.
Laura Klein, you won the home modification thing. I'm writing it down here. Home mod. Congratulations, Laura. And again, for Karen and Laura and Caitlin and Katie, again, you get those free access to those courses. It's free, but I want you guys to take action. Okay, the home modification. I've learned a lot from that course from Jennifer. But the key here is taking action. It will not give you value if you're not going to take action. So those are we're going to give you special access to that. All right, so let's go ahead and keep on going. Shayna, what are we going to talk about again?
I think we should talk about like what's really cool about the homes, like for adults with disabilities. So, because I don't think people know about this concept of what's called inclusion housing, and I think that'd be really cool to talk about.
What? I'm sorry, I'm not listening. I'm looking at the Facebook.
Are you looking at yourself? So if you go on my groups, which I'm gonna link below after this video, I have 2 homes in Philadelphia. So not only does Optonome have the home healthcare agency side, but they also have the real estate side, which makes it a beautiful collision together. Well, collision sounds like a really bad word, but a beautiful like mix together. So if you get your home healthcare agency, if you want to start one, Optonome will find, and you want to work with adults with disabilities, Optonome is going to look in your location and find a good area that's 1, close to you, and 2, good resources to utilize for adults with disabilities, meaning like public transportation, opportunities to interact, opportunities to engage in the community. So Optonome does a lot of research in your area before starting an agency with you. But once they find opportunities for these homes, Optonome really wants to focus on empowerment, especially for adults with disabilities. They want them to have affordable housing. They want them to get a job, and we're the ones that help them get to that. So I have 2 houses right now in West Philly, and these houses are like incredible. They look way nicer than mine. It's crazy. I had a real estate investor buy the 2 houses. 1, I don't have to manage the home. 2, I don't have to pay for anything in that home. I just manage my clients with disabilities in that home. But that home is really cool because if you could envision my home, when you walk in on the first floor, that's like the kitchen and like places where they can interact. There's like 2 big floors in there. Second floor is going to be adults with disabilities. And then third floor is going to be Airbnb. So it's like, at first I was like, whoa, that's like really interesting. But then once I found out the reasoning behind it, I was like, holy crap, like that is a really cool idea. So
the adults with disabilities serving the Airbnb, and do you think they can earn money out of it too? I guess, right? I mean, they need to earn a living too, right?
Yeah. So like in their ISP, their individual support plan, it says like Jim is looking to get a job. So he can learn learn job skills within his own home, or social interaction. He's working on improving his social interactions. He can learn that in his own home. So like that's incredible because 1, he can get paid for it. 2, you can get paid for it. And that service is double. When you do supportive employment, that rate that you normally are getting from your DSP is actually double. So that's even better for you. And 3, you're actually like doing meaningful things. Like that's my passion, is to get adults with disabilities working, because around 90% don't have a job. So having this healthcare professional, like helping guide them to that, and it's in your own home, is like incredible. And it's really cool. And actually Google and Apple are trying to do it, but we're like ahead of the game. So I just wanted to throw that out there.
Oh, wow. I think I've seen in Facebook or whatever, YouTube or whatever, about those kids with disabilities, and they're working in a coffee shop and something like that. Is something like that, right? I mean, is that how you can support them too? Taking them to the coffee shop or whatever, that they work there part-time during the afternoon. Is that what it is for?
Totally. So you can have work opportunities outside of the home, and that could actually be an activity in itself. Jim is working this week to go to 2 stores and ask 3 appropriate questions about, if their job, if that company is hiring. 2, where's the resume, or 3, like how to apply. Like you don't even have to, you can make that whole process part of their activities of daily living that they're doing. And you're getting reimbursed for it. They're actually getting meaningful activities out of it. And it's just a really cool experience. Actually, what I'm excited about is one of my houses, the first floor is going to be a daycare center. So that's really cool. Yeah.
Amazing.
So,
we just have to be really creative about it, right? So, all right. Okay. There's a question here. I don't know what I'm doing right now. What is the name of your group?
Yep. Okay. It's a long run-on sentence because it's like, how do you word this? But it's all slow down. CEO of your own therapy or RN run home healthcare biz. I'm going to type it right now.
Just type it there. CEO of whatever. So, all right. So, all right, let's go ahead and do some raffle again. Let's make a good raffle today or tonight. All right. When is your birthday, Shayna? I mean, just the day. Okay. I don't want your month and your year. We'll just get
out.
Yeah. just the date. Just the date.
Well, we already said 7, so it's July 2nd.
July 2nd. So you want number 2?
We did do number 2 already.
Okay. Let's do July.
What about 7 plus 2? So 9.
9. Okay. So we're raffling. We're doing the VIP thing now. Okay. So we're gonna count from the VIP from the top comment all the way down. So I'm gonna go up here now. So VIP, whoever commented VIP from the top, number 9 going down. So VIP, where I'm counting 1. Nobody's commented this, just 1. 1, 2, 3. My eyes are burning. 4, 5, 6. What number are we at? 9. 6. There's no 9. Nobody commented 9. So,
come on, people.
No, nobody. So, what? Give me a lower number. My eyes are burning. Oh gosh, I'm crying. You're making me cry, Shayna. I guess I'm gonna cry more if I get that 500,000, right?
You should.
All right. So give me a lower number. Lower number. We're gonna count from the bottom to the top.
All right, let's go with 5.
5, okay. All right, so we're gonna count from the bottom to the top for the VIP, okay? All right, so I'm gonna go from the bottom to the top. VIP, come on now. VIP 1, 2, 3, 4. Come on now. And you said 5, right? and 5, Jacqueline Darnell. Woohoo! Jacqueline Darnell, you won VIP. Learn how to teach online through VIP or teaching online. Let me just wipe my eyes again. I'm crying. My eyes are burning. Oh gosh. I'm tired. Oh gosh, I'm tired. So all right, okay, where are we at now? Let's finish up this raffle. Okay, give me another number, Shane.
Let's go with 3.
Number 3. Okay, number 3 for the VIP. We're gonna count from top to bottom. Okay, 1. Nope. Oh, gosh. Ooh. Number 3, right? 1. 1. Come on now. 2. 3. Marianne Kelly. Marianne Kelly is smart. She put 3. So she won the VIP, the second VIP thing here. Marianne, congratulations. Marianne Kelly. You won the VIP. So I guess I got a comment here. You won. So you won. So, and then I'm going to comment on Jacqueline Darnell. Where are you at, Jacqueline? Go ahead and talk. I'm sorry for being such a bad host tonight.
I think this is fun. I mean, I get excited seeing who wins, so it doesn't bother me.
Won.
Okay. Let me look back at some of these questions to see if we answered them. What is the age lowest for the adults with disabilities? Do they work for the ARC programs? I don't know what the ARC program is. Probably Dennis Sticker, the CEO, knows. I'm sorry if I don't know that, but what is the age where you can have them? So you can start 18, like when they get out of high school. But most adults with disabilities normally graduate around like age 21. Not all of them, but actually I had one kid in Philadelphia who was graduating at 23. And I was like, I thought you aged out at 21. But yeah, so it's when they graduate out of their high school and they're ready to learn like transition learning. So, these houses, these affordable houses that you create, you're able to take these not students, take these young adults and help them learn all these life skills, learn how to take public transportation, learn how to get a job, learn how to make a meal, learn how to balance life, how to, bills, electrical. Like, you're going to teach them that. Like, maybe one month they're going to be over a
I need
lot in
somebody
their
to teach me to
electrical
do
bill.
that.
Yeah, it's gonna work on both ends,
Yeah. Oh, I'm learning. All right. Okay. All right. So, our
It's like
next
when you realize you
raffle.
have your week.
Yeah, I know, right? So, our
When
next
you're in
raffle.
your week, you're like, oh, I'm gonna do the exercises too.
Oh, yeah, that's what we've been doing, right? That's what we've been doing. All right.
Yeah.
Okay. Let's go ahead and finish up the raffle prices. I'm not in the Facebook group right now, so just check out whatever they're doing or asking there, Shayna. The next will be the Alzheimer's Disease and Dementia Care Seminar, the course that I teach. It's a CEU course. CEU course. It's an 8-hour course that we teach. It's a 2-day course.
This is the hot one, people.
The hot one, right? The hot one and the more expensive one. Gosh. Well, anyway,
Woo!
I'm going to be teaching it tomorrow. It's for those who've been CDP. I'm really proud of you guys. And the CDP is also going to be complimentary with the Optonome. Oh gosh, they're asking the foreigner to say this crazy word,
You
and
said
it's
it
way
right.
past my English time.
You got it.
So it's past 6:00. I'm running out of English. So if you hear me talking gibberish, that's not speaking in tongues. That's my it's my language, Tagalog. Okay, so let's do a raffle for that Alzheimer's disease, the CDP course. Okay, the CDP course. All right, give me a what is the day of your anniversary, Shayna?
Oh no, come on, that's a long number.
Okay, well, never. Am I putting you on spot? Okay.
Let's pick another number.
The first number or the number of your house.
That's 16, 17. So let's go with the first number. Number one.
Number one.
Yeah.
1. Number 1. Are you sure? So whoever the first person who commented CDP on the top will win the CDP course. Let me go down. Oh gosh, whoever that's number 1. Gosh, of all the numbers you're gonna choose. Well, whoever.
You told me my house. My house is 1,617. 1617. That's.
You already said number 1. The first person who commented is Molly Murray Gusick. So congratulations, Molly Murray Gusick. You won. I will see you. Well, let me comment. You won CDP. Woohoo!
Yolanda, right, you should get called for effort. I see you out there. I read your comment. I'm sorry. Yolanda's been trying to win everything, but she's been missed out. Yolanda, she just wrote on the group, I should get a prize for effort.
Hey Yolanda, if I where's she at? So let's go check her out. Let me go back to the Facebook thing there. Okay, Yolanda, what's going on? So where's she at? Where's the Facebook Live here in my computer, in my cell phone?
Lisa had a good question too, Mike. She said, who will your agency serve? Like, what's your agency going to look like? I know you just started, so I know you're getting used to understanding the concept and getting, everything together. But what are you seeing your agency looking like?
Me? Are you asking me?
Yeah.
Our agency or my business right now?
You're getting started with Optonome. Well, first of all, what's your name? Did you get your name figured out yet?
I sent it to Dennis. I sent him 3 First is the Premier Home Health and Care, or Premier Home Health and Wellness. I think that's what we figured out, because I have the Tennessee Therapy outsourced for my staffing agency, and then the Premier Physical Therapy and Wellness for my outpatient, and then Premier Home Care and Wellness for the Optonome. So I guess that's what we chose. So I don't know if it's going to be approved in the state or not, but hopefully it will. So thank you for that question, Lisa. And again, congratulations to Molly Murray Gusick. So or Yolanda, I think you should get a prize for your effort. I'm going to give you a prize. Here is your prize. There you go. There you go. Just kidding. All right. Okay. What else are we going to raffle tonight? Let me go back to our post there.
He's saying to pick higher numbers. I'll pick higher numbers, but it's taking Mike a while to count up to, what was it, 5? We had a hard time with 5.
I know, right? I'm so slow. Where did our post go? Okay.
Post your questions if you have any right now with Optonome. They're getting started. The 2 populations that we serve, adults with disabilities or older adults. Like I said, there's 11 states getting started, and it's growing each month. And, the whole process of getting started should be as easy as possible for you. It shouldn't be a hassle. Even financially, we didn't even talk about that, Mike, but if you want to know what the total for starting an agency is $5,000, but it's in increments. So you start out paying the first month $250 for the first 4 months. And again, Optonome wants to invest in you. So you don't start paying the additional $4,000 until you're up, running, and making revenue. So that's their security with you, making sure that you have that security with them, that, until you're up and running and your agency is earning, that's when you start paying that back. And again, it's in increments as well. So you don't feel that jump of any money going out. You should be having that increment system throughout the whole process. So that should make it easier for you.
Well, I guess some of the questions too is how does Optonome earn their money? How much is the percentage they're going to get from the total revenue? Is there a yearly fee that we need to pay, like a licensing fee, franchise fee, good looking fee, or whatever you call that? Whatever, hidden fees, credit card fees, name it. There's so much hidden fees. So is there any hidden fees that we need to know? Yeah. Can you share that?
Okay.
We want to be transparent as much as possible. Well, not too transparent that I'm going to be invisible like a superhero, but you know what I mean. So
I need to do more lives with you. You're like super fun, but so Optonome is completely transparent. So one, they're only going to invest in you if you have the skill set and your location is a good area. Optonome is not going to take your money especially if you live in a very rural area, like there's only 100 people in your town. That won't be as successful. No, you have areas. Dennis researched and he found good areas for you. Mm-hmm. Yeah, if you're specific town, but they'll look in that area. And if you're willing to drive a certain amount, Optonome picks a location that will be successful for you. So then once you get onboarded, once you have your agency started, you have 2 people that you pay out. One, your DSPs who are providing livable wages that you're providing livable wages to, and 2, Optonome, 10% of your total revenues. But Optonome is your complete back office. Your EMR, your HIPAA compliance, all of your state and federal regulations are constantly being updated within your specific state. So you're always in compliance. Your billing system, your taxes, your way to connect with your DSPs. So let's say a DSP calls out, or a DSP doesn't even show up to the house. The Optonome technology is super fast that it actually is very proactive. So let's just say the DSP doesn't show up. Within 30 minutes before they're supposed to arrive, if their phone isn't moving because Optonome is within their phone through an app, it will signal to that Optonome DSP pool that I talked about for another DSP to come out. So you're not running around with a chicken with like your head cut off. Like it proactively does that. So you don't call out people. You don't have, can you please come in? It does that all for you. It automates a lot of this stuff. And then it also actively is constantly making sure your agency is within compliance. So there's no one else outside of Optonome that you should be paying for marketing. That's Optonome. Marketing, Optonome gets you your referrals. You do not have to market yourself. So yes, it's 10% of your totals plus the DSPs that you provide a hourly rate for.
Okay.
Sound good?
Yeah. So before we go to the next raffle, there are some questions here again. I'm here on the right whatever you call this thread right now. So Elizabeth, Shane already answered that question. Are there startup fees for joining Optonome? It's $5,000. First, you're gonna have to pay just $250 for the first sign up, and then until you reach $1,000, and they're not gonna get the remaining $4,000 until you are up and running. So that's good. Technically it's just $1,000. All right. I mean, I know I'm not saying it's just, it's $1,000 is still $1,000, but considering that you're going to open up your own LLC, finding all these resources, I think it's going to be a good investment too. All right. Angie has a question. Investigator position, a telecommute or remote job? I think
a
it's
certified investigator.
Angie is asking, investigator position, is it a telecommute or remote job? No, it's not, right? It's an on-site job, right?
Yeah, certified investigator. So here's the other cool thing about Optonome. Like, it's game changer. It's proactive. It's supposed to put us first, again, the healthcare professional, and to be able to provide value-based care. That's why Optonome is your whole back office. So you don't focus on all that back end stuff. Like, you just focus on direct care of your consumers. So certified investigators, we're taking that as a proactive approach. So you should be having certified investigators coming in and out of your agency just to check up on it, making sure that you're in compliance for when the real like big dogs come in and then start auditing you. So we use the certified investigator as a proactive approach. So you are used to the system and you are able to know what's going on and how you're staying regulated. So that is an on-site job. That is $50 an hour. And that is what a DSP can get trained into being. But a certified investigator also comes out if there is an incident. So they're also for that reason as well. We are trying to use certified investigators as a proactive approach.
Okay. All right. So Mercy, I know you. I call her Ate Mercy. Ate means an older sister. So her question is there any licensing here needed? So I guess that's yes, right? Because you need the license.
Yes. So you get licensed and to have a home healthcare agency. We get you all the way up to dean status, which is like the ultimate home healthcare agency that you can get to. Like when you think of those big guys that like when you think of trying to think outside my head, like Beata or like those big ones, that's how Optonome can scale you up to that point. So when you're looking at how your services get paid, Optonome gets you qualified with waivers. So like in Pennsylvania, there is an autism waiver, an older adult waiver, and a consolidated waiver, which is for intellectual disability and dual diagnosis. So Optonome gets you qualified under those waivers, and each one of those waivers has certain specialty areas that you get additionally qualified for. So that's how you get multiple payers that you're able to get qualified for and provide multiple services to benefit the consumer and to utilize it without having any middleman. So I hope I answered that question as best. Did I miss anything?
Yes, you did. And then Chrissy Taylor here said, is the revenue a specific amount? I don't know what
Yeah, so it has, okay, so let's talk about how you scale your agency. So I just want to say you walk in the door of your agency, okay? You're first starting out with non-medical services. So again, if you are trying to earn that six figures, and you want to have that time freedom, and you really want to make a difference, you can make a difference with both populations, but adults with disabilities, unfortunately with the government, they pay more. So whereas when a DSP services your consumer, in general, you're getting a reimbursement of $30 to $40 an hour versus an older adult, which is $18 to $25 an hour for non-medical services. So if you're trying to, like for me, like I like adults with disabilities, but I also like, I'm a mom, I want to have another baby soon, and I want to have that good balance. So I really am passionate about adults with disabilities, but also there are like financial incentives as well with working with adults with disabilities. There is a higher reimbursement rate that you get from servicing them. So when you're saying like, what are the revenues that you get from it? It depends on a couple of things. So let's talk about the adults with disabilities. When you look at their ISP, their individual support plan, it will state in there how many hours the DSP is allotted for that person. You as the healthcare professional can actually fight for more hours if they need it, but their hours could be anywhere from 10 hours a week to needing 24-hour supervision. So just off of that alone, that can range in how much you will make. That's one thing. And then in terms of the different types of services you provide for them, for example, if you're doing supportive employment, that initial rate where I said it's $30 to $40 an hour that the DSP is getting reimbursed, it's called community inclusion. Community inclusion is a service rate across all states. The wording could vary a little bit, but that's where you make $30, $40 an hour. When you do supportive employment, you're getting anywhere between $50 to almost $70 an hour. So again, when you ask like how much revenue can you make, it depends on the type of service you're providing as well as the number of hours you're putting in. So if you want to make six figures and you're working with adults with disabilities, you need to work 10 hours a week to be able to start making six figures. And then if you want to, and then like 6 months to a year after you are, you have your agency, you can start to go medical, and you can provide medical services, which is again, direct therapy services, direct PTOT. If you want to make, if you want to own a 24-hour care home, if you want to have a nurse on site and you want to provide, or if you want to provide medication management, those are all medical services, and that's how you can get up to that $500,000 range if you add on those medical services for your adults with disabilities. So I'm putting it very grossly. I have a ton of videos that I can show you and walk you through them through my Facebook group to really make it simplified and for you to get that. But it's a Friday night, it's 9:30. I just want to keep it simple. 10 hours, adults with disabilities. That's how you can start generating a six-figure salary for providing non-medical services only.
Awesome. So I'm a numbers guy. So you mentioned about $40 for the reimbursement. You pay your DSP, let's just say 15 and 20. So you still get extra, 20 something dollars, right? And that's how you scale your business, guys. That's how you scale. You can't do it all. If you are wanting to really scale, you need to learn how to delegate. You need to learn how to give the just like a PT and a PTA. The PT has to delegate the treatment to a PTA, and same thing with owning a business. You can't do everything. You have to learn how to delegate it to your DSPs. So thank you for sharing that, Shayna. All right. Okay. I think we got to change this, because I'm seeing some posts that they're commenting in the actual live video right now. So we still got the mentor thing. So give me a number again, Shayna, for those people who wants to win the mentor. How about your zip code?
What? 19083?
What's so 19? Let's do the 19. Oh, wait, it's too.
Okay.
Okay, let's do the 19. Let's put the number 19 for the mentor. So right now we're gonna raffle the mentor course, the MENTOR. MENTOR. I want you guys to, whether you buy this course or not, or you win this course, it's really a very valuable course. We could have priced it higher. It's actually 197, but MENTOR means letter M is learning how to meet a need. The course will teach you how to find your specific niche in whatever field you want. So that's letter M. Letter E is learning how to educating your niche, educating your clients by doing podcasts, creating your course, creating your book, and everything like that. So the next letter will be N is learning how to network with other people. The course will teach you how to network with other people, and that way you can scale yourself. And the next letter is letter T, finding a team of people or winners that will push you to your next level. Basically, that's just like networking. And letter O is one-to-one. It's going to teach you how to coach people one-on-one. And then last but not the least, letter R is finding the repeat and recurring revenue. The actual course is actually some sort of an autonomy. You found a niche, and that's letter M, meeting a niche. And letter E is learning how to educate. You're going to be basically educating your DSPs when you go and visit them once a week. And then letter N is learning how to network with people. And basically, that's what me and Shane is doing. We're networking. And letter T is finding a team of winners. And that's what you're going to do. You're going to hire and interview your team of DSPs to be a winning team in your community. And then letter O is one-on-one. Basically, you're doing one-on-one coaching to your DSP, one-on-one coaching to your consumers or your clients. And last but not the least, letter R is repeat or recurring revenue. Guess what? Your DSPs, when they go to your clients or consumers, that's a repeat and recurring revenue. I think Dennis needs to pay me teaching that mentor course.
So, you will
all right. So what's the magic number? Number 19. So number 19, we're gonna start from the bottom. We're gonna count again. 19 numbers. 19.
That's what I said. All right. While you're doing that, let me answer a question then. Let's go with Chrissy. If a doctor enjoys working with you, could they contract you personally, or would you have a rep reach out to them? So Optonome does marketing for you, but if you have a close partnership with a doctor already, you can do that, again, with adults with disabilities or with older adults. So if you already have like a referral source and want to use it, go for it. But Optonome helps you to get your referrals for you. So you don't have to market yourself. Let's keep going. Is the cost cheaper if we already have an LLC business name set up? So actually, it's better just to start fresh. So we normally make you start fresh again because like Med B, a lot of the Med Bs, like they're just qualified in the therapy direct service. And again, we're a home healthcare agency, so we're getting you qualified for multiple payer, for multiple services. So as a result of that, you normally have to have a new LLC because of that. Are Florida and Oregon in the 11 states? Okay. Florida
I don't have 19 on my mentor comment, so give me less than 5. Give me a random number from 1 to 5.
Okay, number 4.
Number 4. Okay, I hope we got 4. All right, so let's go back. Okay, go ahead. 1.
Okay, so
2.
Is Florida one of the states? Yes, Florida is popping. If you are in Florida, sign up for your free home healthcare agency in a box. See if this is something you want to do. We have people starting in Florida in the north, south, east, and west of Florida. The really big hotspots, which is just like, I call it the no-brainer, because if there's a lot of agencies getting started in your area, it's very successful for you. It benefits you, your consumers, your community. So I'll tell you the hotspots right now. Pittsburgh, Philadelphia is huge, Atlanta, Georgia, South Carolina, especially Charleston, We got Orlando, we have Fort Lauderdale. Those are the big hotspots right now. The other states that are getting started are, well, I don't know all of them off the top of my head, but we have Maine, we have Iowa, we have Illinois, we have Louisiana, we have Florida, we have Pennsylvania, we have Georgia, we have Tennessee with Dennis with Mike. There we go. I'm missing a couple.
I could be
ones.
Dennis, as long as I have his bank account,
Yeah.
Duh. Yeah, I can be Dennis, All right, we already got a winner for the first mentor raffle. Sally McLeod Thomas, you won the mentor course. Woohoo! MENTOR. So, all right. So that's the first thing there. So we got one more for that. Give me a random number, 1 to 5 only, Shayna.
Let's go number 2.
Number 2. So second person who commented mentor. 1. Gosh, somebody. Molly, you already won. It's not, Molly commented mentor too. So, but Molly, well, yeah, Molly, you already won the CDP. Let's give this to other people. Okay. How about that? I guess that's fair anyway, right? So, give me a next 1 to 5 again.
Number 3.
Number 3. There you go. Ivy Enting. You won the mentor course. Congratulations, Ivy. Yay. Ivy Enting. I'll put down you won. Mentor. You won the mentor. I don't even know how to spell mentor course. Somebody commented I need to sleep. So yeah, I need to sleep. All right. Congratulations, Ivy. Ivy Enting. I'm very proud of you.
I lost you.
I think there you go. All right. Anything else that we need to raffle?
Well,
Molly Murray got very good. So I guess there's one more. There's one more. This is what we're gonna offer. The last raffle is actually our one month subscription to our masterclass. So me and Emma, we're gonna be launching this special masterclass wherein it's gonna be a weekly webinar, weekly stuff like this that we're gonna be doing. Me, Emma, Shayna coming over, explaining stuff and everything. So we are basically offering that for $200 for a whole year. You get my Alzheimer's disease and dementia care seminar. You get all the courses that we offer, the one that we just shared, and then what else? and then all the mentorship that we have. And if you want to do it just monthly, it's just $20 a month. It's very affordable, $20 a month. We spend $20 a month just eating out. We ate out at McDonald's like $25, $30 already for the whole family. And I think $20 is very reasonable. But if you want to get the package of getting my course, the CDP course, the other courses, you have to pay the one-time fee of $200. It's a pretty good deal. But if you can afford the $200, you can do the monthly $20. So we are going to raffle 2 of that, 2 1-month free subscription to whoever commented masterclass on that previous video that I did last night. So, all right, let's go ahead and get a lucky number from Shayna, our special guest for tonight, who is very, very gracious. I know it's almost 10 o'clock in her time zone. Is it your sleeping time, awesome. Shayna?
Oh, I'm good.
You're good?
I had my chocolate and I'm like,
are you used to partying? You used to party, right? I know I party, I party.
Oh my gosh, yeah.
Yeah, that's my dance move, What's your favorite dance move when you were, how young are you? I mean, never mind. I grew up in the 80s and 90s, we have that move called single, single, double, double, single, single, double. That's our dance move there.
I
So,
think mine was the twerk generation. So we're
gosh, are you that young?
maybe I don't know. I don't
Mine
know
is
what
Macarena, one little dude and did the Macarena. So yeah, I mean, gosh. Okay, so I guess what we're gonna
out
do
of
for
it.
this last two masterclass raffle is my zip code. How about we do that? My zip code, my first number on my zip code. My zip code in Martin, Tennessee is 38237. So we're going to do the first number 3, and number 7. So 3 for the first 3 person who commented masterclass, and then 7 on the last, from the bottom all the way up. How about that? Is that fair enough, Shayna, do you think?
That sounds perfect.
Sounds
And
perfect.
while they're typing in, I'll answer another question. Is Optonome a good business in Dallas, Texas? Heck yeah, it's a good business out there. There's so much good opportunity, and we have a satellite in Dallas, Texas. So we haven't had anyone that's opened up yet there, but you should definitely jump on board. That's a really great state to sign on board. Did you get the person yet?
No, nobody commented masterclass. 2, I got the second
I'm going
one.
to comment. That sounds like a great deal.
2.
I feel like I'm missing questions because we keep having all
3.
these.
I saw the third person. Amy Holcomb Seaman, you won 1 month free for our masterclass. Amy Holcomb Seaman. Amy, congratulations. I am so thank you very much for commenting. I would say
Congrats,
you
Amy.
won the 1 month masterclass. Woohoo! Congratulations, Amy. I'm so proud of you. Okay, so we're gonna go number 7. 7 from the bottom all the way up, right?
Mm-hmm.
7 from the bottom all the way up. 1, 2. Oh, 1, 2. Oh, 1.
While he's counting.
Angie commented twice. Well, we'll count that. 1, 2, 3. 4.
While Mike's counting, I'll say,
5.
I'll throw in another question. Can I sign up for the business in another state if my state is not included in the hot areas? No, I'm just saying, like, if you are in those areas, those hot areas, like, those are like no brainers. Like, you should sign up. You'll have a great community to start with. But they're like, get started in your state, because the more people that start up in your state, the more then it'll become a hot area. I'm just saying that these hot areas, like, you already have a community that are getting started. You have people to connect with. You have this great sense where it's almost like a no-brainer, because people are just starting their agency. The more agencies in your area, actually, the better for you. So, all right, Mike, did you get the person?
Yeah, I was so scared that there was no 7. Julie Randall, congratulations. You won the 1 month free of the masterclass. Woohoo! Oh gosh, I'm tired. Congratulations, Julie. I already commented there, so Emma's going to get mad at me for giving out all these courses here. But Emma, we love you. Thank you very much for all you do for our group. Emma is one of our administrator here, and thank you very much, Emma, for letting us raffle all these awesome courses that we have. Shayna, any last parting words that we can get from you since we're partying tonight? Disco, or whatever. All right. I'm crazy.
Yeah, sure. I will say definitely sign up for your home healthcare agency in a box. It's free. It will give you a lot of the questions that I went over. It's going to go into more depth, even more depth than I even went over today. It's going to go over your business plan. It's going to go over the payers. It's going to go over your state stuff. And then you can get started for free. You can put in your licensing profile and you get started for free. So sign up for your free home healthcare agency in a box to see if this right for you. And then 2, join over to my group and see all the other agencies getting started, see me getting started. My agency's about to launch in the next 2 months. And Here's a little surprise for tonight. So we are raffling.
Surprise!
Surprise! Can we handle any more raffles?
I know, right? I mean, this what, is this a great show or what? I think I don't have any energy for my class tomorrow.
This is our new gig, guys. That was a surprise. No, I'm just kidding. So with Optonome, why our raffle wasn't in for tonight was, again, the Optonome is about creating an agency for you that is successful. They will not choose you if your area or your skill set isn't matching well. So again, if you wanted to win our raffle, sign up for the link that I'm going to post below after this video, and we will raffle. You will get your first payment paid on through Optonome. So a $250 value. Optonome will pay your first month's fee. Like I said, it's $1,000 down or $250 a month over 4 months to get your agency started. But Optonome will pay the first month for you. So sign up for that link. Right? I know.
I'm not going to pay. Okay, I'm not going to pay for it. It's going to shake. Yeah. Okay, not me. Okay, guys, we've given enough.
Mike.
All right. So thank you very much, Shayna, for doing that. But here's the thing: before you sign up, please do mention that you found, or if you're signing up, please do mention that you found Optonome through our alternative careers group. And that way, we get a little bit of, to tell the truth, we have some affiliate commissions too as a group, as a what do you call this? As the alternative careers for rehab professional, we get a little bit of commission. We get the whole $5,000. Just kidding.
Yeah.
So no, I wish, right? So we get a little bit of commission. I mean, probably, I don't know. With Dennis, probably 4,000. Just kidding. So it gives us some sort of a we only work with people who we know, we like and trust. And when you are putting in, for example, you're putting in, hey, we learned Optonome through Mike or Emma or the Alternative Careers Group, please do that. And that way, it shows that that you like and trust us. So Alternative Careers Group, thank you very much for all you do, for watching. For those people who are watching right now, we've got 46 people who are watching. I think this is a good interview tonight. And thank you very much, Shayna, for giving us inspiration, for giving me perspiration, and for inspiring us tonight that we can be our own boss. We don't have to. I mean, it's okay to be an employee. There's nothing wrong being an employee. But if you really want to take control of your life, if you want to be a blessing in your community, a blessing to the people that wants to work for you, start your own business. It's not for everyone. It's not for everyone. Obviously, it takes a special person, a special level up person to start your own business. But the only way for you to be able to level up is start your own. I felt it. I had the anxiety of getting fired. I had my own small contract company. And the only way for us is to learn how to scale, and be the best for ourselves. So again, thank you very much, Shayna, for coming over. I really appreciate you. I know it's 10 o'clock in your time right now. It's 9 o'clock in my time. And again, Alternative Careers Group, before I let you go, I want to remind you the word FAST, FAST. First is find friends that will push you to your next level. Find people, find a coach, find a mentor that will bring out the best in you. And this is a perfect opportunity for us to be mentored by Dennis, by Shayna, by the other people in this group, because you are the average of the 5 people you hang out with. Who are you hang out with? That's my question for you right now. Right now, we're hanging out with awesome people right now. Hang out, find people. Find a coach. All right. What's the next letter? Letter A. You got to learn how to take action. Why? All these videos, all these freebies that we gave out tonight, those are free. Obviously, sometimes people don't value it, but you got to take action. learn from it and take action. All right. Learn from it and take action. Whether it's a big action or small action, learn from it and take action. What's the next letter? Letter S. You got to learn how to shoot for the moon. You will fail. We will fail. I fail all the time. I get rejected all the time. And you will never know. Even Optonome, it's not a sure ball that you're going to be a 6-digit, 7-digit, $300, $500, $500,000 earner. But you got to learn how to shoot for the moon. Why? Because when you miss it, you're going to be eventually landing with the stars. I want to land with the stars like Shayna. You know, look at her. She's beautiful. She's a star right now in the show, right? And last but not least, learn letter T. You'll learn how to teach it. All this stuff that we're doing, I've learned it from somebody else. And I want to teach it to you. And once you've learned it, teach it to other people. Then that's what Optonome is here for. They're teaching us. And that way you can also teach and share that knowledge to other people. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it. Shayna's teaching us. That's why she knows what's the system. All right, Shayna, anything else that you can add through that? Any special parting words from 6-digit CEO, Optonome lady, whatever you call that?
No, I think you worded it beautifully. You know, we're here to give you time freedom, financial freedom, but really make you feel valued again as a therapist or as a nurse, if there's any nurses out there. Like, this will empower you and this will get you back to your roots. If this is something that you're calling, yes, you can financially make 6 figures, but you will actually feel valued. And I think that's an important piece out of the whole Optonome platform, is you will feel valued. So that's my 2 cents.
Amazing. That's actually worth 500,000, right? I love what you said about the roots. We need to go back to our roots. You know, if you're a therapist watching right now, and I'm sure a majority of us here, we need to go back to our roots. What are our roots? Why did we go to this profession? Why? It's not about the money. Yes, the money's good, but why did we come into this profession? And we want to leave. Why? Let's go back to the roots. Why? We want to help people. And this is the perfect opportunity to help people. I'm helping you right now find your alternative career. Shayna's helping us right now to go back to our actual roots, which is helping people. If your niche or your plan is to take care of individuals with disability, aging in place, reach out to Shayna. Of course, tell it's from ACG or from Mike, and in that way we can get credit. But I wish you all the best. Thank you very much, ACG. Thank you, Shayna. I appreciate you. And always remember, be awesome, be great, be excellent. And thank you very much. And we will see you again. Thank you, Shayna.
Thank you.
You have a good night.
And Mike,
Bye-bye.
You're awesome. Come on,
Bye-bye.
You know you're awesome.
Oh yeah, I know. That's my middle name. Actually, it's not. So, I can't pretend that's my middle name. I'm not American, so.
Oh, this was fun. Right. I really like this.
Well, thank you very much, Shayna. I appreciate you. Have a good night and be awesome, be great, be excellent, ACG. Thank you very much. Bye-bye. I hope you enjoyed the show. Check out our website at drmikechua.com or alternativehealthcarecareers.com for more information. Again, ACG, be awesome, be great, be excellent. Thank you, and hope to see you on our next episode. Goodbye.